A happy new year to you and welcome to Foreign Dispatches. I'm Teniola Shoboale. On the program this week, the coronavirus pandemic made 2020 a year that no one will ever forget. From vaccines to social distancing and new ways of celebrating, we look ahead to 2021 and how the pandemic has changed the way of life around the world. Vaccines. Wherever you are in the world, either your country has begun mass inoculation or is planning to do so in 2021. In the UK, a second vaccine by Oxford and AstraZeneca has been approved for use. It comes amid rising coronavirus cases and fears of a new, faster spreading variant identified in the country.
The UK has ordered 100 million doses of the Oxford AstraZeneca vaccine, enough to vaccinate 50 million people. The first immunizations of the jab will start on January 4.
We've got 100 million doses on order. Add that to the 30 million doses of Pfizer, and that's enough for 2 doses for the entire population. So I can now say with confidence that we can vaccinate everyone, except, of course, for children, because this vaccine has not been trialled on children, and anyway, children are much less likely to have symptoms from the disease.
The Oxford AstraZeneca vaccine was designed in the first months of 2020, tested on the first volunteer in April, and has since been through large-scale clinical trials involving thousands of people. It's the second jab to be approved in the UK after the Pfizer-BioNTech vaccine was given the go-ahead in December. More than 600,000 people have been vaccinated since then. The new vaccine approval comes after Public Health England said the country was facing unprecedented levels of infections, and the health officials in parts of Wales, Scotland and the south of England voiced concerns about the increasing pressure on the NHS.
Let's face it, this has probably been the toughest year that most of us can remember. That's certainly true across the health service, where we've been responding to the worst pandemic in a century. Many of us will have lost family, friends, colleagues, and at a time of year when normally we would be celebrating, a lot of people are understandably feeling anxious, frustrated and tired. And now, of course, again, we're back in the eye of the storm with this second wave of coronavirus sweeping Europe and indeed this country.
Meanwhile, more than 20 countries, including the United States, have confirmed cases of the new coronavirus first identified in the UK. As a result, many countries have banned flights from the United Kingdom. The US Centre for Disease Control and Prevention recently announced passengers from London to the United States will need a negative coronavirus test from the previous 72 hours. Public Health England says initial analysis shows that while the variant appears to be more transmissible, there's no evidence it's linked to a higher risk of hospital admission or death. Officials say that the coronavirus vaccines currently being distributed are likely to still work to protect people against the new strain.
Yes, as far as we know, this is effective against the new strain. Now, that's really important because we've discussed many times on this programme, the strategy is to suppress the virus until the vaccine can make us safe. And today's news is great news for the ability of the vaccine to make us safe and make us safe faster than we previously could have done.
But with the United Kingdom seeing a severe winter surge of infections, public officials are taking no chances and have effectively locked down southern England, including London.
EU countries on Sunday embarked on a vaccination campaign to defeat the nightmare of COVID-19. The vaccine is a glimmer of hope for a continent yearning for a return to normal from a pandemic that has killed 1.76 million people worldwide.
From Florence to Frankfurt, Paris to Prague, a cross-border vaccination program of unprecedented scale was launched in Europe on Sunday, December the 27th. After European governments were criticized at the start of the coronavirus pandemic for failing to work together, the hope now is that a coordinated response will ensure equal distribution of vaccines across the region, home to 450 million people. The EU has secured contracts for more than 2 billion vaccine doses and has set a goal for all adults to be inoculated during 2021. At the front of the queue in Germany was 101-year-old Gertrude Haas, who received Berlin's first vaccination at her nursing home. A smiling and cheerful Haas said she was happy to be one of the first after initial doubts.
The virus is very dangerous. We hear and read about it, and there are so many people dying in other care homes. It's horrible, and that's why it's so good that we can be vaccinated against it. It's a big advantage for all of us who live here.
In Rome, Nurse Claudia Alivanini was among 3 healthcare staff to receive Italy's first shots of a vaccine developed by Pfizer and BioNTech. She urged other Italians to follow her example, saying medicine and science are the only means we have. Austria also started the vaccination program on Sunday, with vulnerable population groups being the first ones to get the first COVID-19 shots. Frontline workers are also priority. In the Czech Republic, Prime Minister Andrej Babiš became the first person in the country to be given a vaccine against the new coronavirus on Sunday. Babiš received the Pfizer-BioNTech vaccine at the Central Military Hospital in Prague, just before other hospitals in the capital and second-largest city, Brno, started to distribute the 9,750 doses the country has received so far. While Europe has some of the best-resourced healthcare systems in the world, the sheer scale of the effort means some countries are calling on retired medics to help, while others have loosened rules for who is allowed to give the injections. With surveys pointing to high levels of hesitancy towards the vaccine in countries from France to Poland, leaders of the 27-country European Union are promoting it as the best chance of getting back to something like normal life next year. Outside the EU, Britain, Switzerland and Serbia have already started vaccinating their citizens in recent weeks. The vaccination drive is all the more urgent because of the concern around the new variant of the virus linked to a rapid expansion of cases in Britain.
Over in the United States, on Tuesday, Vice President-elect Kamala Harris received a COVID-19 vaccination in front of cameras as the incoming Biden administration seeks to boost confidence in the inoculation, even while warning it will be months before it is available to all.
Cummings administers vaccination, injecting it into Harris' shoulder.
That was easy. Thank you. I barely felt it.
U.S. Vice President-elect Kamala Harris received the first dose of the Moderna COVID-19 vaccine live on television on Tuesday in Washington, D.C., and urged Americans to get vaccinated for the virus.
I've now been vaccinated. As Joe likes to say, there's a big difference between the vaccine and vaccinations. I want to encourage everyone to get the vaccine. It is relatively painless. It happens really quickly. It is safe.
The U.S. Food and Drug Administration has granted emergency use authorization for 2 coronavirus vaccines, one from Pfizer and BioNTech and one from Moderna. Both Moderna's and the Pfizer-BioNTech vaccine have shown similar efficacy levels of near 95%, and both vaccines require 2 doses administered several weeks apart. The Vice President-elect's vaccination comes just 1 week after President-elect Joe Biden received his live on national television. Democratic President-elect Joe Biden, who takes office on January the 20th, has said he will make the fight against the coronavirus, which has infected more than 19 million Americans and killed over 334,000, his top priority. U.S. President Donald Trump has not yet received the vaccine, and officials say he won't be administered one until it is recommended by the White House medical team. The White House official said at the time that President Trump was still receiving the benefits of the monoclonal antibody cocktail he was given after he tested positive for COVID-19 this fall, but that the president was likely to get his shot once it was recommended by his medical team.
While vaccine announcements offer some hope for 2021, experts say the pandemic is far from over and there remains a long road ahead. Strict stay-at-home orders were renewed indefinitely on Tuesday for much of California, as the state's top health official said that many hospitals were on the brink of crisis.
California extended a strict stay-at-home order on Tuesday for the majority of its residents, as hospitals in the state said they were on the brink of crisis. Tough restrictions imposed earlier this month on social and economic life in Southern California have been extended indefinitely. Los Angeles County has been particularly hard hit by the virus, with 90% of hospitals there overwhelmed by an influx of patients. Over the past weekend, they've been forced to divert incoming emergency patients to other facilities.
So we are seeing more and more. He's extremely sick. I would say this is one of the worst ones we see when a lot of staff has to go in emergently to take care of those sick patients. We are seeing more and more of these. Our ICU is full, apparently, with a lot of COVID patients who are on a ventilator. And we are seeing specifically way worse than, I would say, compared to what we did before.
California Health and Human Services Secretary Dr. Mark Galley says some hospitals had been forced to weigh up the effectiveness of certain treatments for certain patients who are unlikely to survive.
So those decisions are happening throughout impacted regions now. There are emergency room physicians and ICU clinicians and nurses looking at how they stretch themselves effectively to so many different patients.
While he says hospitals aren't rationing medical supplies and treatment, he expects conditions to get worse as the surge in infections from the holiday season translate into hospitalizations. Residents are being urged to stay indoors and avoid travel, except for grocery shopping, medical appointments and exercise. Restaurants are only able to do takeout and bars have been closed altogether in what are some of the toughest restrictions in the United States.
Like Britain, South Africa is battling a variant of COVID-19 that medical experts think is more infectious than the original. Health officials warn that the health system is on the verge of being overwhelmed by the combination of higher numbers of COVID-19 patients and people needing urgent care from alcohol-related incidents. As a result, the government has imposed tougher restrictions to curb the spread of the virus.
South Africa's health workers are more anxious about the hiking infections of the coronavirus cases in the country, worsened by the fear of a new virus variant identified in the country. According to local health officials, the new coronavirus variant has been driving the second wave of infections in the country, with cases increasing sharply on a daily basis. South Africa's Health Workers Union says the situation would become worse if new cases continue to rise at the current rate typically registered on Christmas Day, with infections of 14,796 cases. Rich Sachina, who is the Young Nurses Indaba Trade Union's General Secretary, shares the same concern. South Africa's public health system has been described as broken, and the government also admitted that there is an urgent need for significant reforms.
And with the added weight and the surge, the numbers that are rising right now, the healthcare system is most likely going to collapse. And to make matters even worse, we are now in a festive season where we've got all the trauma cases that are increasing due to alcohol and all these other things.
Facilities are understaffed as the pandemic has added more strain. President Cyril Ramaphosa has announced new tougher coronavirus restrictions to curb the spread of the virus.
Funerals may not be attended by more than 50 people with social distancing. The nationwide curfew will be extended from 9 p.m. to 6 a.m. Apart from permitted workers and for medical and security emergencies, from now on it is compulsory for every person to wear a mask in a public space.
On Sunday, South Africa became the first country in Africa to pass 1 million officially recorded COVID-19 cases, with almost 27,000 deaths since the outbreak began in March. Last week, it recorded a daily average of 11,700 new infections, a rise of 39% on the previous week. And from Wednesday to Friday, the daily number of new cases was above 14,000. President Ramaphosa says the country is at an extremely dangerous point in the pandemic and action had to be taken.
When Foreign Dispatches returns in just a moment, we head over to Iran to take a look inside a Tehran hospital on the front lines of the coronavirus pandemic through the eyes of a 36-year-old nurse. Health workers, the heroes of 2020, who fought on the front line against COVID-19, displaying the best of humanity. 36-year-old Iranian nurse Sumaya tells us what it's been like on the front line in the fight against COVID-19.
Like thousands of key workers around the world, Iranian nurse Sumaya Hosenzadeh spent the first 40 days of the pandemic on hospital front lines. As a supervisory nurse, Hosenzadeh and her colleagues provided the majority of patients' day-to-day care, working back-to-back shifts even on vacation days, as the number of hospitalized cases was on the rise daily.
Many of my colleagues got infected with the coronavirus, but they continued their work with more determination than before, because they themselves have suffered this pain and they are trying to get better in order to take care of patients.
Separated from her family for 40 days, she describes the first few months as a war scene.
It was tough. Certainly, the worst time for us is when we see the death toll of the coronavirus is increasing, and every time we see a person die, we know that he or she is a dear family member, and we feel the pain of losing a person, like someone from our own family died.
Iran's health ministry says 60% of nurses have been infected with the coronavirus, and 10 months on, Hosenzadeh's uniform still consists of a mask, double gloves, a cap, a hazmat suit, and overshoes. To remove all these at the end of the day is delicate and complicated, she says, but necessary in order for her to safely go home. Iran has been the worst hit country in the Middle East by the global pandemic. It launched human trials of its first domestic COVID-19 vaccine candidate on Tuesday, December 29th, according to state media. Tehran says it could help it defeat the virus despite U.S. sanctions interfering with its ability to import vaccines.
In China's Wuhan, the epicenter of the COVID-19 outbreak, life for the city's residents has more or less returned to normal. From people crowding onto a local ferry to take in sights, to those dancing in street squares, nightlife in Wuhan is back in full swing over 7 months after the city lifted its strict lockdown.
For most people living in lockdown around the world, they can only dream of a party like the one in Wuhan, China. Here, young people crowd surf, pack nightclubs and bars without masks, and chow down on street food. The central Chinese city, Wuhan, was the original epicenter of COVID-19, but 7 months after coming out of one of the world's most strict lockdowns, its nightlife is back in full swing. Wuhan's revival is a glimpse into a post-pandemic world that many hope for in 2021 after the global rollout of COVID-19 vaccines.
Wuhan is very safe and stable now. It's not like Wuhan during the pandemic, when everyone felt scared. There's no scary feeling anymore here. We now take good precautions, and when we come out, we wear masks, and it's necessary to wash our hands. Now I don't feel tense anymore.
During the epidemic time, Wuhan was really a dead city, but after it reopened, I had never seen so many people. Now people are all coming out to eat and have fun. I don't think there were as many people before the epidemic.
Despite the thriving night scene, Wuhan business and restaurant owners say it will still be some time before the surge in turnover makes up for massive losses during the lockdown. But for patrons now flooding into Wuhan's nocturnal hotspots, the message is more straightforward.
After experiencing the first wave in Wuhan, I feel like I'm living a second life. I just really want to cherish this time, because in life, you never know when it will end. So I'd say, live well every day, and have a good life every day. Make every happy day count.
At the start of this year, the industrial city of 11 million was isolated from the rest of the country, with road traffic all but cut off. Almost 3,900 of China's 4,634 recorded COVID-19 deaths were in Wuhan. The city hasn't reported a new locally transmitted case since early May.
Elsewhere, though, things are far from what they used to be. Elderly people have been particularly hit hard by the COVID-19 pandemic. Since they are more vulnerable to becoming seriously ill, many have faced months of isolation, unable to see loved ones in person for fear of infection. With outbreaks in care homes leading to thousands of deaths across Europe, many shuttered their doors to relatives, but innovative solutions are offering some solace.
In one care home in Cologne, Germany, a virtual reality headset allows 81-year-old Anneliese Richmond to escape the confines of her four walls and take a tour of the Cologne Cathedral. After removing the headset, laughing, she vows to return herself once she can get out and about again. Social worker Alexandra Kasper says digital media like virtual reality and computer games is helping to boost communication and morale during the difficult time of the holiday period, when relatives will normally be visiting more frequently.
Most relatives are very understanding and say they don't want to risk anything. They want to protect their loved ones and know they do their best by not seeing them as often. Of course, Christmas is a very sensitive time, but some visits are possible and always take place in a secure room. It's a hard time, we all have to get through it, but we'll manage together.
Facing the same challenges, another care home in the city of Speyer opted to replace its annual Christmas party with an outdoor Christmas market, complete with sausages, waffles, and a tombola. While it won't replace the traditional get-together with family members, the care home's manager says it's a safe way to create a festive atmosphere.
Normally, we have a lovely Christmas party in the chapel and the cafeteria with all the relatives, but we can't do that now, so we looked for an alternative to bring a bit of festive atmosphere.
The head of Germany's Ethics Council warned in December that isolation and loneliness could severely impact the health of elderly people. The council called for care homes to make more contact possible, both through digital solutions and in person, with the right precautions in place. Crystal Honey says video calls alone aren't enough to replace in-person contact. She's unable to visit her husband of over 50 years in his care home. For now, care homes say they're doing their best to keep residents cheerful. Some are even offering Zumba classes to put a smile on everyone's face.
As hospitality industries across the world have been severely impacted by the global health crisis, many dining places are shut down or laying people off. Amid such grim circumstances, in a one-of-a-kind move to attract customers, a restaurant in Colombia has started offering the gold-plated burger. Take a look.
A Colombian restaurant in Bogota has turned one of the world's most beloved food items into a luxurious cuisine by adding an exceptional layer of 24-karat gold. The luxurious dish is on the menu of a restaurant in the Colombian capital and costs about $59 each. On the other hand, a regular burger costs only $11.
The idea of the McCoy Gold was born from a trip made by the owner of Toro McCoy to Turkey. He ate the steak with gold leaf, so he decided to bring the idea here to Colombia. It's a unique idea because you don't have to travel to try an experience like this.
In between the brioche bread are double beef patties, crispy caramelized bacon, crispy onion, double cheese, topped with 5 pieces of 24-karat edible gold leaves imported from the United States. The restaurant industry has been hit hard by the COVID-19 pandemic, with restaurants around the world laying off people, some shutting down and many reporting unprecedented losses. Despite government subsidies, many businesses are struggling to stay afloat. The gold-plated burger is part of many endeavors on the part of restaurants to bring back customers in the aftermath of COVID-19.
And that's the program today. Thank you so much for watching. Wishing you a happy new year. Do stay safe while celebrating. I'm Teniola Shoboale. See you next time.